Tonight on Studio One.
Why your baby's head is wonky.
And in the kitchen, there's Wolfie.
Studio One.
Live from Dubai.
Now, flat head syndrome is the name given to the condition when part of a baby's head becomes flattened due to continued pressure on one spot.
There are different conditions. There's a condition called plagiocephaly, there's a condition called scaphocephaly, as well as brachycephaly. These are all positional deformities that children acquire early on in their lives. What it in fact is, the skull consists of different growth plates. And early on in the child's development, the skull is very flexible and very soft. And any external pressure or abnormality would subsequently actually evolve into a flat spot. Vast majority of these conditions do correct on their own. There is some evidence that it's associated with other underlying factors, for instance TMJ with the malalignment of the jawbone, as well as other issues, though that these aren't the driving factor. It's more cosmetic and the person's right to have a proper head shape that drives my treatment protocols. As soon as there is a head deformity present, you'll see the pediatrician pulls out one of these tools and he starts taking measurements. He starts taking the width, the length, as well as the transverse. You'll see your pediatrician starts measuring certain areas in the face. Now, this is quite a complex and time-consuming way to treat it. And more importantly, you don't have actually a very sophisticated outcome review. What we do with these referrals, patients are referred to us. We have this very neat little piece of equipment. It's called the STAR scanner. It's cutting-edge technology. It takes 2 seconds to scan a patient, and it gives us a huge amount of information. It uses 3D cameras and very, very sophisticated algorithms so that we have a 3-dimensional replica of the baby's exact head shape. It's totally non-invasive. The baby's not exposed to any radiation. It's 100% FDA approved, and it's used in all the major pediatric centers in the world. And one of the things that I always tell parents to do, look at the bird's eye view. Look at the baby from the top. And as soon as you do that, you can use your fingers and you can reference the holes in the ear. And as soon as you do that, it changes the whole way. And you can actually see, for instance, in this case, it's a significant asymmetry, where not only are the ears malaligned, and you can see it right through the frontal area of the face. And sometimes the only thing the parents did is, instead of just looking at the baby from all sides, they actually went from the top and put them down and reviewed. Unfortunately, if you reach 6 months and the physiotherapy and the other protocols have not worked, then you need to introduce something called a cranial band. It's an externally applied device that we apply over the baby's head. And what we do is we don't apply any pressure. What we do is we just steer the growth of the skull in the right direction. Unfortunately, we do see babies coming here at 1 where the deformity is of such a significance that we are unable to treat them. And again, that's why if we can identify it early enough, the physicians can introduce the right referral process, no baby is going to have one of these on their head, and that's our goal.
Follow your instincts. If your baby's head does not look round, go to your pediatrician. Go and speak to them immediately. Make sure they do all the measurements. Make sure that they refer you to, in this case, Sean, with a scanner, and get it sorted as soon as possible.
Today we've learned how crucial it is to treat your child's flat head deformity. A little extra care to your baby's growing skull today can lead to a happier tomorrow.
The flathead syndrome unfortunately affects almost 47% of newborns these days. Elham, thank you so much for that report and for telling us more about the condition.
Little tip you can do at home. This is the actual cast that we got from the Mediclinic. So put your fingers above the ears and then push your fingers up onto the top of the head. Now your fingers should connect on top of the head. They shouldn't do that. If there is a gap there, that's a sign, as they said.
Wow.
Seek advice from your paediatrician.